All right, so we're going to pick up talking about paradigms again. And here we're going to talk about behaviorism and cognitive behaviorism. And I'm sure some of you have taken behavior modification as a course and are very familiar with the tools that are used to modify behavior from that paradigm. But all of you have taken Psych 111 and have gone through the chapter on learning and operant conditioning and classical conditioning. And these are the principles that are being used here to shape behavior. And so the idea from a behavioral perspective is that we don't need to worry, essentially, how behaviors came to be, and so we're not interested in delving into the history of early childhood the way we were with psychoanalysis. We're not interested in providing insight to the person about why they're behaving in certain ways. We're simply looking at problematic behaviors and then coming up with an intervention plan to change the behaviors. So if somebody is engaging in compulsive behavior, so the woman I mentioned in my last video, right, a past patient who had compulsive behavior. So in her case, she collected newspapers. That was her compulsion. We'll talk more about this, or can talk more about this in the chapter on OCD. But the behavior that was problematic was that she couldn't throw out newspapers. She also had other compulsions that were checking behaviors, checking to make sure she hadn't run somebody over with her car. Was one of them. And so these are the problematic behaviors. And from a behavioral point of view, the goal for the therapist is simply to stop that behavior from happening so that life can go on in healthier and more productive ways. And so more using operant than classical conditioning. Behavioral therapist might look to see how you might reinforce alternative competing behaviors, how we might extinguish the problematic behavior, and so often this involves fairly detailed behavioral plans. This is one of those paradigms where you do get people who are simply behaviorists. And so if you have a degree in behavior analysis, you actually are not trained or possibly informed very well on the other approaches to therapy, that that behaviorism and behavior analysis is used almost exclusively by people who practice like that. And often they're treating developmental disorders such as autism spectrum disorder, and looking, and so they're often treating populations also where insight does not feel like a particularly useful tool. And so that, there aren't many outpatient therapists in general practice who only use behaviorism, but there are lots of therapists in outpatient practice who focus on using cognitive behaviorism. And cognitive behavioral therapy has that behavior in the word, but cognitive behavior therapy adds the element of thinking, not necessarily in an insight-oriented way, but focusing on how patterns of emotion and thought then lead to certain behaviors. And cognitive behaviorists will use, kind of very specific tools to do that. And I'm going to try to pull up a tool so we can look at it together. All right, so I've pulled up a thought diary that I use as a cognitive CBT tool. And I need to say here, that I mentioned in the last video that I often am psychodynamically informed, so I've had lots of training. A lot of my most formative years of therapist training were with supervisors who were very psychoanalytic, and my own kind of inclination is to want to kind of solve the puzzle of what is driving somebody's problematic experiences and behaviors. And so I often am doing insight-oriented therapy, but I'm not exclusively doing insight-oriented therapy. For some people, that is the primary thing we do, and for some people, it is something we don't do much at all. And I really am one of those therapists that I mentioned earlier, that I feel like I have a toolbox, and I reach into the toolbox to, I look at the person in front of me, I think about how they're struggling and what they're struggling with and who they are, and then I take tools out that I think will be most useful to them. And so this is an example of a CBT tool that I created. It is not unique to me. This is just one I developed specifically for a specific patient. But this kind of thoughts diary is a very common cognitive behavioral tool. And what it asks essentially is for the person, as they move through their week on their own between sessions, to make note of a date. So they have an experience where they're struggling in some way, and they make note of the date, perhaps the time also, the situation. I'm sitting home alone, or I'm out to dinner with my husband, or whatever it is. Um, and then to think about what the automatic, so this one was about risk and pessimism for this person. I'll show you another one in a second. Um, but what are the automatic pessimistic thoughts that they're having, or what are the pessimistic predictions that they're making about essentially for this person that things aren't going to go well in some way, right? So they're out on a date, right? So they're at the situation that they're out on a date and they find themselves thinking, there's no way this is going to work. He or she is too nice for me. They're not going to like me, right? And then the emotion they start feeling is sadness, and or depression, and then the thing that therapy is working on is this other column here, which is to take some of what we've been using in therapy and to say, I have a pattern of thinking like this. There's nothing going on in this situation that is predicting it. This is just kind of the way I think, not what I'm not responding to something, information or data that's actually in front of me, and then the outcome, I felt less sad. I was able to reset, and so trying to get at kind of essentially a disconnect between emotions and the kind of the thoughts and the emotions, and trying to kind of disconnect those. Let me pull up another one. And so here's another thoughts diary that is about anxious or uncomfortable thoughts as opposed to that risk and pessimism that we saw. And you can see this is detailed in some new ways compared to that one, but we still have the situation, what's happening. In this case, I've added a behavioral column. So this is somebody who has rigid or ritualized behavior when they're feeling anxious. What are the thoughts they're having that are going with those behaviors, and what is the emotion that they're having, and asking how long. This is simply, right, you don't see an intervention in here the same way you did where there was a column about that rational thought. This is simply a data collection tool for me, and not just for me, also for the client. And so I sometimes will have clients who, in the first or second session, I give them a diary to bring home, simply because I want to see, when are you feeling most anxious? In what situations do you become most anxious? I'm just looking to get a handle on getting more understanding of what situations they struggle with most. And I have had on more than one occasion, and I can think of one client in particular who came back into the next session with her diary filled out, saying, I see patterns, and her pattern that she saw was that if she was trying to juggle too many tasks, she would become very anxious if she was rushing and having unrealistic assumptions about how much she could get done or in what time period. She would get overly anxious if she talked to her sister on the telephone, especially while she was driving her children someplace. So again, a juggling, but in that case more of an emotional juggling, that conversations with her sister resulted in a day where for the rest of the day she felt very anxious. And so even on her own, she was able to see these patterns of cognition. And again, the goal, I'm going to come back, hang on one sec. All right, the goal of cognitive behavioral therapy and the goal of these tools is essentially to unlink, right? To create a pause is how I like to think about it. A pause between the thinking you're having and the emotions you're having, so that in that pause you have the ability to see your thought patterns, to try to counter kind of whatever automatic thoughts, to be able to see that you're having the automatic thoughts. So if you are studying and you start having, thoughts of like, what's the point? I'm going to fail anyway. I always struggle with school. Sometimes when we're having those thoughts, we're not even kind of paying attention to the fact that the thoughts are happening. And that's what I mean by automatic. They're just kind of coming unbidden into our head. And then suddenly you're feeling sad and pessimistic and unmotivated. And you may not even really have paid attention to the fact that you were telling yourself things were pointless before you got sad and unmotivated. And so the point of the diaries, the point of the therapy is to try to see those thought leading to behavior patterns, and in seeing them create enough of a pause between the thoughts and the emotions, that you can kind of say, oh, there I go again, like there it is, I'm doing that again, and then using tools learned in therapy to try to create more distance, and to try to, that column where it was the rational thoughts, to kind of counter with other thoughts. We will talk a lot about cognitive behavioral therapy, especially when we talk about depression and anxiety, because I think the vast majority of therapists, even if they're mostly doing insight-oriented therapy, are bringing CBT tools to treating those two things. So we're going to stop with this video now, and in the next set we're going to pick up thinking about neuroscience in these particular ways. We're going to talk about neurons and neurotransmitters. We're going to talk about brain structure and function, a little bit about the endocrine system, and then all of that will inform the use of medication as a treatment approach.